have, it looks like about 20 people joined. So I think our meeting is now officially starting. I want to welcome you all. Again, my name is Izzy Scheikoff. I'm the Director of Housing Services at the Maryland Department of Aging. And I also want to introduce to you all our chair, Tiffany Nicolette, who's the Vice President of Housing and Services with CHI in Baltimore. Also have some excellent MDOA staff on the call as well. Deanna Graves, who's our Program Manager for Housing Service Division, as well as Jonathan Jenkins, who is going to be helping us. He helps the department on a lot of things, but with regard to this meeting, he's going to help some with technical support in case we have some issues going forward. You all should have the agenda that we sent out. And with that, I can turn this over to Tiffany to help us with intros.
Gosh, looking for my unmute button. Thank you, Izzy. And I just want to say I am so excited to be a part of this initiative. I'm really honored to be able to work with the Maryland Department of Aging and with Izzy to sort of get this work group up and running. As you probably have seen, we have quite the task on our plates, but I really think that we can do it. I think that the state has provided us with a lot of guidance, and I'm sure when Izzy asked us to kind of familiarize ourselves with some of those documents, and you probably open it up and we're like, wow, 300 pages worth of but there's some really great summaries, and what has come out of those documents, I think, gives you an idea of like what the priorities are and where we could go. And there are some solutions already that are kind of embedded in there. And so it's really on this group to work together to pull those ideas out and then figure out how we can kind of move forward. So I know we have quite a few folks on the call today. I think we have a really great team, and I'm looking forward to getting to meet everyone. And so what we thought we would do is to start, maybe introduce yourself, your name, your title or organization, and then list 2 things that brought you to this group today. And then the very last important step is to pass it on to the next person. So even if you don't know that person, just call out their name. And this will kind of keep everybody looking alive because you don't know when you're going to be called. So I will start. Tiffany Nicolette, Vice President of Housing and Services for CHI. So I oversee our affordable housing portfolio as well as our senior home repair program. The 2 things that brought me to the group today, it was very interesting to me to have the opportunity to use my education, skills, and career experience to really make a difference on a big picture level. So that's number 1. And then kind of bringing it down to the micro level, it's really exciting for me to be a part of an initiative that is going to make a difference for people like my mom and ultimately me as I age. So thinking about a big picture, and then also on that micro level too, on how it will personally affect some of us. So I'm going to pass it on to the next person that's on my screen. I see Patricia Jacobs.
Wow, you have to be quick with the mute button. Hello, everybody. I am Patricia Jacobs, and thank you for that little quick intro, Tiffany. I am a retired senior living executive. I've worked for nonprofit and for-profit companies that run independent living, assisted living, memory care, nursing homes, and that was my long career. When I finished that, I did some age-friendly work and got the town I lived in New Jersey certified as age-friendly, so I have strong feelings toward AARP. So housing is definitely where my heart is, and I am actually, on a personal note, founding a co-housing group right now because that's my plan of where I want to live as I age. I want something that is universal design and intergenerational and has a lot of great folks around that are already committed to being in a relationship of service. So I think there are new models out there, and I'm excited that Maryland is open to looking at what's available. So I am going to call on Allison because she's right above me.
Hi, everyone. I'm guessing there's only one Allison. So great. It's wonderful to see so many familiar faces. I'm Allison Siborowski. I'm the president and CEO of Leading Age Maryland, and we're an association that represents not-for-profit aging services providers throughout the state. And I'm really excited to be part of this work, as it not only I see how it affects our members every day, but I see how it affects the older adults that they support, and just wanting to create more opportunities for all of us to have the lives that we would like to have as we continue to live. Thank you. Am I supposed to call on someone, Tiffany? I'm not sure who already went. So I'm going to say Scott, just because he's clear on my screen here.
Hey folks, Scott Gottbrett, Assistant Secretary for Policy at the Maryland Department of Housing and Community Development. Good to see a lot of familiar faces. Hey, Ann Johnson, long time. I am excited about this work also because I think that this is sort of the tip of an important pyramid where you've got seniors that can't move on and out and into better living arrangements that fit their needs. And that means that the houses that they're living in can't be occupied by young families that are looking to form households and get into other homes. So the fact that there's not, supply of senior housing and an affordable supply of senior housing means that the entire housing supply chain is suffering the consequences. And I think we're entering a moment now where there's a broad-based coalition of folks coming together around housing issues, and this is just an important space in which to think through and get concrete about planning and what comes next. And senior housing is one of the most popular forms of housing also. Affordable housing, a lot of communities don't want low-income residents near them, and there's a big kind of firefight over where we're going to situate affordable housing. But senior housing is one of those soft points in community opposition to additional housing growth. It's very obvious, and people have been talking about the sandwich generation, which I'd heard about for the first time a year ago, where people have both their parents living with them and their children living with them. And that's something that is very real in my own household, where we're probably going to be, we're talking about that kind of sandwich generation moment where we'll be housing both our parents and our children at the same time. So it's an exciting space to be here. So great to see so many experts and advocates coming together under this to help address this issue. I'll throw it to Claire Lewis.
Hello, everyone. I'm Claire Louie. I am director of the Tomei Aging Well program with Enterprise Community Partners. Our program offers support to organizations that support older adults aging in community in Maryland and Michigan. So it was a no-brainer for me to be involved in this work because this is kind of where I live every day. I'm also a proud member of the sandwich generation, having both adult children and my 82-year-old mother living with me. So I will pass it to Ruth.
Thank you, Claire. Hi, everyone. I'm Ruth Griffin. I'm the Housing Counseling Coordinator with the Community Development Network of Maryland. And housing counselors connect consumers with important resources to meet their housing needs. And we're seeing increasing difficulty aging in place or meeting housing needs in our senior community. So I'm really glad to be here to promote the work of housing counseling and try and ensure its sustainability as we need to connect more people with the resources that already exist. And also, it's great to be here to learn about what resources I might be able to bring back to housing counseling groups and let them know what more is out there that they can connect people to when folks are in need. And I will pass to Melanie.
Good afternoon, everyone. My name is Melanie Reese. I'm the Executive Director of Older Women Embracing Life, and I'm a founding member of Maryland Coalition on HIV and Aging and several other groups. But I am in this Longevity Ready Maryland because the executive order that was signed by Governor Wes Moore had nothing to do with people living with HIV and some of the other communities that I work with involved in that. So I have to make sure we're not left out of this one. And I don't know who has gone before me. Is there somebody else that needs?
I can jump in. So I am Lauren
Okay.
Avarella. Oh, sorry. Did I cut someone off? No. I'm Lauren Avarella, Senior Program Director at nonprofit called Civic Works in Baltimore, overseeing a bunch of housing initiatives as well as some service coordination in senior buildings. I am here because the affordability around being able to provide the proper services for people seems to be lacking a lot. I think that there is a lot of money that is being put philanthropically into some programs that are really helping people to age in place, but there is not funding like reimbursable funding through Medicaid or Medicare that can be accessed by nonprofits. And that is creating a huge gap in sustainability of programs that have been around for a long time. And so I'm here to hopefully focus on the sustainability of programs that are extremely important to older adults and how we continue to afford to do them. And I will go with Shanna.
Hello, Shauna Humphrey. I'm the director for the Area Agency on Aging for Garrett County, Maryland. I joined this because I wanted to make sure that Garrett County had a voice when it comes to a long-term plan. We are very rural and we're much closer to West Virginia than we are to Baltimore. So sometimes it feels like we're a little isolated out here. And the other reason I joined was we've tried a couple different senior home modification programs within our county, Capable being one of them. And then we were included in DHCD's application for a HUD older adults home modification program over the next 3 years. So we're really just trying to identify ways to keep seniors safe in their home for as long as they want to be there, and kind of creating an opportunity for them to be able to do so. Affordable housing in our county is very limited. I'm sure a lot of us have that same experience. So just trying to find opportunities to make that a safe option for them to help align with what their wants and needs are and try to create a better space moving forward. And I will pick, I'm not sure who went yet. Let's go with Robert Thurston.
He may not be on.
There we go. There I am. Hello. Robert Thurston, Neighbors Helping Neighbors of College Park, which is trying to help people age in place. All volunteer nonprofit organization. I'm also involved with the College Park Senior Advisory Committee. I'm here today because of that work, but I would also say that life experience is also why I'm here, because I am have been in the sandwich generation, and just I feel like that's a very silent piece of aging that we don't experience because it's being handled by family. But it's so thank you for being here.
You want to toss it off to somebody else?
I'll go.
Okay.
I'll go. My name is Robin Heath. I am the program coordinator for Fight Flight Be More. Also, wear 2 hats, the operations coordinator for the SOS Fund, where we do our direct services, mainly with a lot of seniors in Baltimore City, helping them, assisting them with property taxes, water bills, ground rent, We do a lot of referrals to, I heard Civic Works on the line. We do a lot of referrals to help get home repairs done and help seniors, mainly seniors. We help everyone, but a majority of our population is seniors to be able to age in place.
All right, I'll throw it to the next person. It looks like on my screen, Ann Johnson.
Okay, hi everyone. My name is Ann Johnson. I'm with 211 Maryland, the United Way Helpline, and we are the helpline for health and human services that is available 24/7. We help any Maryland resident to find the resources needed, and my specific role is to onboard and train our social work interns, our volunteers, and our new hires. We often get calls from older adults who are having challenges with any basic needs, anything, food access, help to keep the lights on, housing resources, anything at all in the realm of health and human services. So that certainly is one of the factors that drew me to want to serve on this work group. I'm also co-lead for the Equity, Diversity, Inclusion Committee at United Way of Central Maryland. Our work there is to make sure that our workplace is a workplace where all are having a voice and able to be their authentic selves. And so taking a look at the policies that we have in place at United Way regarding our workforce and keeping older workers engaged and easily able to continue to work. That's another reason that drew me in. I'm very excited to be here and look forward to this work. And let me see if I can tell who hasn't gone yet. Has Carolyn True?
I have not gone yet, so
Oh.
I will take the opportunity. Hi, everybody. My name's Carolyn True. I am the AAA director for the Frederick County Division of Aging and Independence. I'm also right now the acting division director for the division. And I'm very happy to be here and on this particular work group because Frederick County is very interested in the four goals that are a part of this work group. So I'm glad that I'm able to add Frederick County's voice to this conversation. But another reason that I'm also very interested in being here is because I'm interested in change. And I think change is very necessary, particularly when we're talking about affordable housing and affordable health care and financial security and access to long-term services and supports that are going to keep older adults in their homes, in the communities for as long as safely possible. So I'm very happy to be here and thank you for the opportunity. And I will ask David Engel for his thoughts.
Thank you, Carolyn. I'm also very glad to be here in this group. I am the chair of the Montgomery County Commission on Aging. I'm also professionally a residential real estate agent licensed in Maryland. I have 4 generations of my family living in Maryland, lived in Montgomery County my whole life. So I have a vested interest in the improvement of bringing more generations to the state and staying here. In Montgomery County, our community assessment surveys always say or return the results of how much people love living in the county and the amenities and services that they have, but they can't afford to stay here. So recently, Montgomery County's public forum, where Scott was a guest speaker, so I'm glad you're on the call today, we talk about affordable housing and what we can do, and the state is certainly interested in improving that with the initiatives that they took this year, and the same with Montgomery County. But our theme at the Commission on Aging is that we can do better. And we also had a public forum on home care recently, and our theme was home care, we can do better. So there's a lot of things that other people are doing around the nation that we can take a look at. And I'm glad that you put some resources in the handouts on what other people are doing, and I think we can utilize that. So I will. There was one other thing that I wanted to say, but I'll have to leave it for another time. And I will hand it over to Annie Sparks.
Annie said in the chat, I'm off today on the road, so I can only do chat for this meeting. I work as the Chief of Aging Transportation for Queen Anne's. Two things that brought me to this group is my passion for the aging field of caregiving for my 91-year-old father and seeing how difficult it can be to navigate everything.
Do I get to hand it off to someone else, Scott? How about Ashley Rust?
Hello, everyone. I hope you guys are having a good day. So my name is Ashley Rust. I'm the Hub's floating case manager at Civic Works. So a little bit of background. I worked in home health along with pharmaceuticals during my undergrad years. That made me a lot more passionate about older adults and the services. The two reasons why I want to be a part of this group is because there's a lack of information with gerontology services. A lot of it is generalized, and then it's really hard to navigate for the older adults. And then I also spent over 10 years caregiving for my grandmother who had dementia while at home. So I'm very passionate about aging in place. And then who can I pass it on to? I hope I don't repeat a name. Let me know if I do. I see Chelsea on here. If not, I can call out somebody else. I also see somebody, Mary Lou. I'm just calling out people I don't think I heard yet.
Hi, I'm Mary Lou Gorig, and I'm a resident of Rockville, Maryland. I own Science by Tomorrow for 32 years, and I represent the public sector. I am one of those seniors still working actively at 75, and I'm a proponent of continued employment for people to help them afford longevity. I also have a husband with Parkinson's, so I'm very interested with ways to age in place and make him comfortable as well. And I'm also a workaholic, so I love volunteering and helping people. So I can't tell who else hasn't gone. There, Robert Thurston.
How about, so Robert has gone. How about Dan Martin?
Thank you, Tiffany. Hi, I'm Dan Martin. I am the Senior Director of Public Policy at the Mental Health Association of Maryland, and MHAMD chairs for at least 20 years now a coalition, a mental health and aging coalition that brings together scores of individuals, advocates, government officials, and others, all working to address the unique mental health and substance use needs of older Marylanders. And we're really excited about this this initiative. This kind of coordinated approach to addressing the needs of older Marylanders is something that coalition has long advocated for, and it's critically important because the older population is the fastest growing population with mental health and substance use disorder needs, but there are real inequities in access to system of care that addresses those unique mental health and substance use disorder needs, and real challenges in affordable healthcare when we're talking about affording healthcare, affordable healthcare, because of the real discriminatory elements of the federal Medicare program. And so again, when it comes to mental health and substance use disorder coverage. And so real happy to be here, and I will pass it off to let's see who hasn't gone yet. Sheila Baldeo. Did they already go? Did she already go?
Baldeo, yes.
Baldeo.
Hi, everyone. I'm Sheila Baldeo. I am a senior advisor and owner director of DJMB Senior Resources. My company is same as like Care Patrol and A Place for Mom, but I'm just an independent. I specialize in management and coordination services for families seeking information on the senior communities. I am a certified dementia practitioner. I also volunteer for the Alzheimer's Association as a community educator and the Parkinson's Foundation as a Parkinson's ambassador. And I'm excited to be here because I just enjoy helping seniors, listening to their stories and, finding out where they're from and where they like to go. And I hear a lot about aging in place, which I think is very important. My mom refused to go anywhere outside of her home. And she passed away at 92 in her home with her daughters taking care of her. So I think that's very important. But there's sometimes that, it's just impossible to stay at home. So that's where I come in. I like to think and help those seniors and those elderly find the different senior communities that will match their needs. Okay. And I will pass it on to, I really can't see anymore here.
I think Denise O'Day, maybe. I'm trying to keep record of who's gone and who hasn't.
Okay.
Hi. Yeah, my name is Denise O'Day, and I currently work for Department of Social Services in Baltimore City. I work with some seniors. I work out of the MOED offices, so I help people. One population is the reentry program over at Mendocino, and then I work on the east side. It's at the Career Center, so I'm contracted in from the state, and I help them with benefits. And I also took care of my parents, and it's tough because they don't want to leave their home. And I found both seniors do not, and housing is a big issue. And what happens is because their income is reduced, and they're in the house for a long time. And I've come across this with a lot of seniors. They can't stay in the house because they need home repairs. Sometimes they don't have family members that can help them. I mean, I helped my parents. I have 2 brothers and a sister, and we all pitched in and made sure their lawn was cut. But I see senior citizens that their roof needs repair. They have plumbing problems. They can't, physically do the general maintenance of the house. Simple things. I have one senior that I've been talking to, and she can't walk down the steps to do her laundry because she said she has snakes in the house, and the washing machine, she's not even sure if it's working because it's 30 years old. She's washing her clothes by hand, and it's heartbreaking. And there's a need, and they're not familiar or aware of some of the services that are available, or they're too proud. And it's a huge need for seniors. We really need to do a better job taking care of our seniors. And that's why I'm here, and I'm about to retire. Actually, this is my last month. So I'll be more available to participate and do a lot of community work and volunteer work. And I'm looking forward to doing that. Oh, let me see if I can. Did we go with Rachel Helfert? Is she on?
Hi, everyone. Yep. My name is Rachel Helford. I'm the Community Resources Manager with Somerset Development Company. We are an affordable housing provider, and we have specifically in Baltimore City a affordable apartment community for seniors. So we have about 270 older adults, 62 and up, that live in that community, and I'm on the resident services team. So we work with our residents to encourage self-sufficiency, and for seniors in particular, we're encouraging healthy ways to age in place and maintain their independence. And I'm happy to join this work group to learn more about what we're seeing at the state level, and then we can hyper-focus it at the community I work with as well. So to popcorn it. I have not been keeping the best track on who hasn't gone yet, Tiffany. I didn't know.
I can try.
Okay.
Letitia Rogers.
Yes, thank you. How are you? How's everybody? Actually, I've been working in senior living for the past 27 years, whether it's independent living, assisted living, or memory care. I also am a business owner here in Maryland. I own a company called Simple Moments, which is a home health company that will go into the homes to assist with their activities of daily living for seniors. The reason why I decided that this is something that I wanted to work with is because I've noticed a change just in the healthcare dynamics, navigating the healthcare system for seniors. But also recently, again, I was also a part of the sandwich situation where I'm taking care of an older loved one. And it was the first time out of the 27 years that I've worked, and I normally am the one that give out the information, being able to let people know where to go to get the help that they're needing. But I found it very difficult when it was my turn, and got very scared, like, oh my God, all these years, you know where to go, where to do, but it was just so hard navigating the healthcare system, especially when you had someone who wanted to live as long as possible in their home, and then choosing the right community to go to once they no longer could. And it was just I didn't feel like I had the support that I needed at that time. I guess.
Thank you. And I can take it from here if
Thank you.
everybody, I've been trying my best to keep track. So Lauren Ryder.
Hi. I'm sorry, I think my camera's not working. I'm the Client Advocacy Services Manager here at the Hartford County Office on Aging. And I'm actually sitting in for Karen Winkowski, who is my director, who couldn't make it to this meeting today. But I know that she is very happy to be part of this work group to make sure that Hartford County has a voice on these subjects. And I'm actually interested now that I'm here because my whole team of outreach, we talk to people every day, all day, about aging in place and affordable senior housing. So I'm looking forward to learning some things and getting some resources. Thank you.
Great, thank you. Mike Case. Mike,
Mike, I can't hear you.
Let's pop to the next person and
How's
we can
that?
come back to, oh, there we go.
Sorry, not used to Google meetings. My name is Mike Case. I am a financial planner with Northwestern Mutual, and I'm also past president of NAFA's Maryland chapter. That's the National Association of Insurance and Financial Advisors, which is a lobbying and advocacy trade organization. So I have been involved with lobbying both in Annapolis as well as DC for nearly a decade now, and saw this really as an opportunity to get a better understanding for what people across different sectors and as well as government agencies are seeing as problems that we face over the next few decades. Is obviously I look at that from a individual and family standpoint when we're planning for our clients.
Great.
Yeah.
I think there's only, and correct me if I'm wrong, if I missed anybody, I think the only person left, Roblin Heath.
I think she went already.
Oh, did she? Oops.
Let's
see. Is there anybody else that I missed? I'll take that as a no.
Is Carl Prather on?
There's somebody that it looks like joined by phone.
I believe that was Roblin had joined by phone.
Oh, okay.
And Izzy Carl is not on today.
Okay, Carrie Grafton,
She's not on today.
Chelsea,
She's not on today either.
and Renee Michelle Lau.
She's not on today.
Stephanie O'Day. That's all I've got.
No, yeah. Those folks are not logged on.
Okay, thank you.
Okay. Sounds like we got to everybody that was able to join the call today. And so Izzy, I think I'm going to throw it back over to you to kind of give us an overview of the Longevity Ready Maryland plan.
Okay. Well, I'm struck by the incredible range and diversity of the folks on this work group. That we're well represented in terms of geographic representation, in terms of our experience, our skills, our perspectives. This is exactly what we were trying to do in putting together these work groups. Because it is critically important that we do bring together that kind of range of perspectives to come up with a well-formed set of recommendations. So we have a very short period of time to cover a lot of ground. And we know this. With this in mind, we're trying to kind of prime everybody by giving you all some background information, resources, and information that will help us get up to speed. So with that, I think the best place for us to, for me to provide some type of an overview that can kind of set our focus and what we're trying to achieve is by going back to the workgroup information and resource packet. Let me see if I can try and share this. Do you all see this?
Yep.
Okay. Yes. Okay, so this was, we sent this out to all of the work groups, but it kind of gives us a sense of where we belong in this process. To start out from the beginning, earlier this year, the Governor Moore signed an executive order that basically put this Longevity Ready Maryland initiative into play. And the idea behind the LRM is to put together a multi-sector plan on aging that evaluates services, support, care options. And it's going to be a blueprint to help us transform the aging experience. This is going to be a 10-year plan beginning in 25 and running through 35. And we tried to identify some major epic goals within this plan and put them into 4 different buckets. So you can see where the third one across, preparing Marylanders to afford longevity. Our priority areas are substantial, affordable housing, affordable healthcare, financial security, access to long-term services and supports. This is a little opinionated, but I think that this is the bread and butter. This is the meat and potatoes of the whole thing. And so I think that's going to be our discussions, I think will be important ones to have, and the recommendations that come out will be important, a very important part to the beginning part of this process. If you look at the timeline here, we're at the front end of this. Even though the executive order was signed at the beginning of the year, this part of the year, from September through November, is when the work groups are going to be developing initial recommendations. They're due by the 15th of November. But at that point, it's just the beginning. At that point, there will be other parts of the process that will further refine our recommendations, and ultimately coming up with a plan that goes to the governor next year, July of next year. Again, this is meant to be a 10-year plan, and it's meant to be multi-sector. And what do we mean by that? Well, essentially, what we're talking about is a planning document that cuts across levels of government, across agencies within government, uh, outside of government. The idea being that we're going to try and connect one another to come up with the best solutions to the challenges that we're confronting. So we're just part of a much larger group that includes an advisory council, the Department of Aging, that will further refine what we come up with. But here's our basic responsibilities. We're supposed to identify what's out there, and a lot of this has been done already. We had this as part of the documents that we've connected at the back of this packet, the available research, and it is not by any means comprehensive, but it's a start and kind of scratches the surface of what's out there in terms of research and data and reports that are relevant to what we're trying to focus in on. We want you all to be prepared to talk about this stuff, we complete our assignments. We want to focus on solutions that benefit the health and well-being, and document and submit our recommendations using a template that we have that we'll be providing at the next meetings. It's really important that what we come up with are things that our recommendations are measurable, and that include short, mid, and long-term strategies. We want our recommendations to be inclusive. We want to promote access, equity, and choice. And we want to build upon, and this is really key, we want to build upon and enhance existing plans. We cannot, in our time frame, realistically boil this ocean. We really need to look at what's out there now and lift up and highlight and emphasize and recommend those things that we think are most important, most relevant to Maryland, most pressing. Okay. We're going to have 3 more meetings. You should have the meeting dates. You should have received the invitations already. September 27th at 10, October 11th at 12, and October 21st at 1 p.m. If you did not get those invitations, let us know and we'll make sure an invitation gets out to you. We're recording everything. We'll have the minutes and agendas out in advance. If you can't attend a meeting, let us know. We're going to try and make sure that we set assignments and objectives for next meetings in advance, okay? This is more detail here. This is important, the defined goals and objectives. Again, I want to emphasize we're building upon existing plans, recommendations, and resources that are out there. We want to promote equity, social justice, and inclusion. Person-centeredness and choice is a very important emphasis of whatever we put out in terms of recommendations. Obviously, the point behind making this multi-sector is so that we can improve efficiency and the collaboration between agencies, between levels of government. We want to look to technology. We want to look to community-led design. Now, we're one of 4 groups. The first one is building longevity ecosystem. The second one is promoting economic opportunity, which is really around workforce solutions and recommendations. We're the third one, which is preparing Marylanders to afford longevity. And then the fourth one is optimizing health, wellness, and mobility, which is a broad range of things: social connectivity, brain health, physical health, transportation, infrastructure, and person-centered care. So we're really right in here. The priority areas being affordable housing, affordable healthcare, financial security, and LTSS. We want to develop recommendations that improve economic security and affordability over the 100-year lifespan that we know a lot of Marylanders are going to be experiencing in the near future. These are recommended priority areas. Under affordable housing, you can see increasing access to affordable housing options, improving housing stability, and the opportunity to age in place, addressing systemic barriers that impact housing equity and the transfer of generational wealth. You'll note that a lot of these priority areas align with the Moore-Miller plan and goals that the governor has already put out. Along affordable health care, we want to come up with some recommendations around these 3 bullets: exploring innovative solutions to ensure accessible and affordable health care, increasing equitable access to health care, promoting technology-based healthcare solutions. Under financial security, again, emphasizing and aligning with where Governor Moore is going, we want to lift families out of poverty, address retirement inequality, and decrease savings gaps by improving access to planning and planning literacy. And we also want to come up with recommendations around protecting financial and employment security. And the last one, under LTSS, we want to come up with recommendations around improving access to affordable long-term care options. Right care, right time, right setting, and also addressing long-term care financing and delivery challenges. No small no small issue there. So these are all really big topics. And I don't want to overwhelm people, because it does seem overwhelming. When I looked at this myself, I thought, oh my goodness, how are we going to do this? But take a deep breath. What we're going to try and do is organize work groups, subcommittees within the existing work group meetings, but we'll get to that. We'll get to that toward the end of this meeting. Are there any questions about how the LRM is organized and what we're supposed to be doing?
Izzy, this is Carolyn.
Yeah.
Does ACL have just an informational role, or do they have another role as far as sending the recommendations to them? Is this just informational?
I'm sorry, say that again. Does the ACL have a role?
Yeah, because I noticed that the recommendations will be sent to ACL as well as to the governor next year. So I'm just wondering what role they have with this.
They're not involved in our planning process, Carolyn. It's a good question, because we're talking about it being multi-sector. So I think that's a really important point. And I have to take that back to the Liz and others at the MDOA to ask them what role do they may be playing a role in the stakeholders advisory group, higher level, or in subsequent meetings after we come up with our recommendations. I'm not sure, but I will tell you this. I think that there's an effort on the part of our agency to try and align this planning tool with what our state plan is going to be, so that they're in sync, and in fact could be maybe a subset of what our ultimate report is. That would be sent to the feds.
Okay, thank you.
I hope that helps. And Melanie, you've raised your hand.
Yes, the Older Americans Act was reauthorized on the federal level, and the states have their own time frame for upgrading to the current new Older Americans Act, and Maryland comes up in 2025. Is this LRM supposed to be that, or is that a separate? Or is it separate from the LRM?
So along the lines of what Carolyn was just raising, the intention of the agency is to try and do all of this together so that the report that goes to comply with Older Americans Act and the state plan that the feds require us to submit we're going to try and use this effort to be a part of that report and part of that compliance.
Because the Older American has priority populations that must be addressed in the new plan. That includes older Marylanders living with HIV, the LGBTQIA communities, and right off the top of my head, I can't remember what the last one was. But we have to be addressed throughout the plan, not just in this Afford Longevity Work Group, but across all phases of the LRM.
Yes, I'm telling you, yes, we are very aware of the priorities that have been identified, and we intend to be inclusive of and lift up some of these groups that have historically not been a part of these plans. And Scott.
Thanks. One thing for the group to be aware of is that the Maryland Department of Housing and Community Development is rebooting our state housing needs assessment. And one of the two kind of drill down components in this year's reboot is senior housing. In particular, we're trying to get longitudinal projections of the number of Marylanders who will not be able to sustain themselves in their current housing and who will need assistance either transitioning to a different housing arrangement or sustaining themselves in their existing housing, either through home accessibility upgrades or there's other kind of accommodations like new roofs or things like that. Our goal is to put a price tag on it. We'll see how close we get to that, or to spell out what kind of different courses of action or funding levels might mean for an effort of this kind. But just putting that on folks' radar is that we've contracted with the University of Maryland National Center for Smart Growth. And so those efforts are going to provide sort of some data that I think would be very helpful for these conversations. And so I can, liaison some of that. The report's expected in, early calendar year 2025, just so everyone knows. And the other thing I was going to ask is the plan that you put up, Izzy, it looks great. Are there other states that are held up as the national leaders in this sort of planning that we could look maybe like what their strategic plans or reports look like and kind of have a role model that we could aspire towards?
Interesting that you asked that, Scott. Yes, there are. In fact, in the work group packet, toward the end, there's a ton of other reports and recommendations inside the state, but also best practices outside of the state. California, Vermont, I think North Carolina. There are a number that I was reading over the weekend and last month about to just really see what they've done, because yes, the answer is quite a few states, 5, 10, a dozen states have already done and put out some multi-sector planning reports, and they're attached. But that, again, is not comprehensive. There's a lot more out there, too.
At the very last page of your work group packet, there's links to about 10 different plans to serve as resources.
Scott, to go back to what you said on the DHCD housing needs assessment, you said you're including in this iteration new data elements that talk about the cost of keeping just doing home repairs. Is that what you said?
Well, so our goal is to identify housing needs for older adults. And so with the aim of quantifying it, ultimately in dollar amounts. So what kind of investments are needed for older adults to remain in their homes or transition to, more accessible dwelling units or apartments. So to try to get some projections on what the housing space will look like for seniors in the coming years and what supports would be needed for them.
Yeah, I think that would be really important new information to have. Thank you. Other questions? Okay. We have next on the agenda, we wanted to solicit everybody's thoughts about, like I said, we can't possibly boil this ocean, but what we can do is start with what makes Maryland unique? What are our unique strengths? What are we bringing to this process that's a part of our state that we should be mindful of in beginning our discussions? Tiffany, do you want to frame this part of the agenda?
Want me to get it started? What my thoughts are?
Yeah.
So I think there's a lot. The first being just our size in, like our geographic size. We're really not we're not a huge state. So I feel like whatever we do, we can kind of scale. I think that really, bodes well for us. I think that, some of the innovations that, I'm sure somebody else knows about this a little more in depth than I do, but some of the innovations that are coming out, like in healthcare, like in 2026, the AHEAD model, and the way that our healthcare currently runs, that Maryland total cost of care, those are all kind of unique things to Maryland. I think that we have a lot of innovative programs that are already happening. Things that maybe they're on a smaller scale, or maybe they're even something like the hubs or the because programs that are maybe county or citywide. So I think that, we have our little individual nonprofits that are doing some great things, but some of us have banded together to cover, a larger territory. And I think capitalizing on some of that knowledge and those existing programs, I think are something that is unique to our area and our state.
I agree with that.
Anybody else have anything to add?
I think the fact that there is the political will to make change.
That's good. I hope you're right.
Me too.
I'm going to put a plug in for my hometown. I'm not an alumni, so it's just because it's my hometown, but the University of Maryland, and I'm going to say specifically, student focus is very high on generational longevity and aging. So that to me is a great asset in two different ways. Our future generation is thinking about us, plus they're actually academically focused on it.
Robert, can you go into that in a little bit more detail?
Scott mentioned the Center for Smart Growth is institutionalized within the University of Maryland. But I am surprised almost every school year about the number, because I am associated with Neighbors Helping Neighbors and Senior Advisory Committee. We're contacted at least yearly, asking about projects, asking to provide people who could participate in some of the research and surveys that they're doing at the university.
Interesting.
I would
Okay.
say that we're uniquely poised with the all payer model that Maryland has within the healthcare system to be able to be more creative in keeping people out of the hospital and using things like housing and other social determinants of health as ways to keep people out of the hospital and have hospital systems pay into programs like that. I don't know if we have necessarily been as innovative as we could be, but I think that we could really push those boundaries.
Agreed. Others?
Yeah, I think that we do a really good job with children and Medicaid and making sure that they have their vaccinations, and I think we do a great job, and I think that we need to do the same thing for seniors because we don't do enough. We just simply don't. I mean, especially seniors that don't have family to help care for them. I think we have like a lot of really nice senior centers, and I think they do a great job. I think we could enhance them with adding more people in the centers in the community I think that would be more helpful to make it more community because we have Maryland is becoming very, very diverse. And I mean, there's really a lot of good people in Maryland. I mean, I work with people even in Baltimore City and in the county that are willing to help. We need to get more volunteers out there to check on seniors, do home checks, and organize, groups to help keep them in their home longer by doing repairs and I think we need, like I said, but we could start with the senior centers. I think that's a really good place to start because we do have a good amount of them in the city and in the county. We need to make them better. And I've been to quite a few, and I see some really, really nice ones, and I see some other ones that are run down, but really filled with really nice workers, and they would appreciate, assistance with that. It could go a long way.
There was an article today, I think, in the paper about Johnny O and some Baltimore County Senior Center that he recently visited and how important their services and their function is to the community there. Melanie?
When you're talking about senior centers, we have a lot of senior buildings in city, and they're not kept up the way they should to provide a safe, healthy place for seniors to live. And for instance, I live in a senior building. I am on the first floor, insisted, because the elevator goes out, people have to use the stairs to get down, and there are people who aren't able to. And so let's say a senior is on the third floor, they have a doctor appointment, they're have mobility issues. Our building has the fire department to come and get them down so they can get to their medical appointment. And that's not just an isolated incident. It happens a lot. So we have to make sure that what we have is optimal for seniors and living safe. And we need more affordable housing options for seniors.
Very good. Yes. Patricia?
I'm inspired by all of you. There are a lot of great ideas. There are a lot of great projects that are already happening maybe not at scale, to your point, Izzy and Tiffany, but there's some really good ideas that are already out there. And that is very exciting, I think. And having moved back to Maryland, I grew up here, but I moved away for college and I've only been back 2 years. I can tell you that compared to other states, Texas and New Jersey and Virginia, the Maryland municipal governments, the strong county governments, as opposed to the individual municipalities of 10,000 people at a time, are a real advantage, I think, in Maryland. The county government system means that there is a broader view than maybe the provincial view of a town of 10,000. So it is exciting that there is commitment, and there is a feeling of progressivism in Maryland that if you've never lived anywhere else, let me tell you, it's refreshing to come back to. New Jersey and Texas are both significantly more conservative overall. So that progressivism is something I think we swim in and get used to, but it is really an advantage in doing something that necessitates change.
I agree with you, actually. I think that it's reflected in the strength of the association that represents the counties, MACO, which is pretty powerful and influential and organized. And I think it's because the members, the county government leadership, is also, right, like you say, they're organized.
I live in Baltimore, and you would not know that it's progressive in Baltimore City because there's lots of poverty and there's lots of mistrust of government, doctors, hospitals, you name it. We have to be not too optimistic. We need to fight because November 5th can make a big difference in a lot of people's lives, even those of us that believe in change and progressive. We can't take it for granted. Everybody has to vote responsibly.
I'm door knocking, Melanie.
Other strengths that what do we got going for us here in this state? David, where'd you go?
There you go. I was a little conflicted about this response, but I'm going to throw it out there because I think one of the strengths of the area is that we do have the federal government workforce here. But then again, when it comes to long-term care solutions, those solutions lie at the HR systems that our private employers and the federal government also use. And the federal government, I believe, is having problems with their, long-term care insurance program. But I think maybe not represented possibly on this call, I'm not sure, listening to all the people that chimed in. There's a lot of great employers, large employers in Maryland, and having them represented at this affordability, group would if one of the solutions to long-term care is a long-term care employer solution with pay-in that some of the other states have employed, that having those really big, great employers that we have at the table to discuss that might be helpful. So I think that's a strength that we have the federal government supporting us here in Maryland, but we also have a lot of great large employers. So something to think about as we talk about what the solutions are for long-term care.
Thanks, David.
So something else to throw out there, and this is rather technical, but the state of Maryland has an actual state appropriation to support affordable housing. so the Rental Housing Works program, and that fills in funding gaps in the like LIHTC projects, but it also gives Maryland the unique ability to kind of steer the direction of housing investments, especially subsidized or affordable housing investments compared to other states. So we have a few more tools in the toolbox than comparable states for controlling the direction that we want to go in housing growth and housing development, especially affordable housing. So there's opportunity there. The General Assembly is keyed in and funds this sort of work already. If we were in a different state, that would be a massive uphill climb to try to get state resources direct in this area.
Scott, how many other states have that kind of financing?
That is a good question, which I do not have an answer to, but I will find out for you.
Okay. I think that it's clear advantage to have that. I also think it's important to point out that the Department of Housing and Community Development was very successful in this past session in passing some very important legislation to allow your agency to do more things faster.
Some things, but the fight isn't over yet. I think we have a long journey to go. But yeah, we'd like to see more housing supply creation overall, not just affordable housing. So people say that there's kind of two ways to go with the affordable housing crisis. You can build more, the more supply versus demand kind of drives down the price, or you can have more subsidized units, right? So more government subsidized units. And so there's kind of two schools of thought. One is to get at affordable housing with subsidy, and one is just build, build, build. I think another kind of tailwind we should mention is that Kamala Harris is a pro-housing candidate. There's a YIMBYs for Harris movement. She's promised massive investments in housing. We'll see what happens in November, but housing is front and center in the national conversation now. And so there's an opportunity for this group to seize on some of the momentum of those housing affordability conversations happening nationally and translate some of that energy to the local level.
Agreed. Other unique circumstances. Ruth.
Oh, Scott's comment actually triggered a thought for me, and that's what a great job the state of Maryland does in leveraging federal opportunities to benefit Marylanders. Other states are not necessarily as organized as Maryland state government is in bringing those federal opportunities to our state and then actually delivering them to the population. So it is a significant advantage for Maryland.
Good point. Good point. Others?
Allison actually asked a question in the chat. She said it would be interesting to see how many of the 9% LIHTC dollars have gone to senior housing development in the last 5 years or so in Maryland. She hears differing opinions on DHCD's role in supporting new affordable housing development.
I'll be happy to gather that information and bring it back. As with the previous thing of what other states also have a state allocation, I can gather that information. One thing that our LIHTC team says repeatedly, I've heard them parrot in settings like this, is that seniors can live in multifamily housing. So all affordable housing that's being built can accommodate seniors. Age-restricted affordable housing is a different question. I think that's the one that folks are asking, is how many can only seniors live in? And I can get that information for you all.
That'd be great. Before we move to the next other topic area, I love to brag on this state when I'm talking to people that are not from the state about how there are such great centers for healthcare and healthcare innovation. Our centers, our higher ed, there's some great colleges and universities, a relatively well-educated population. And it's not a poor state either when you compare in terms of folks' annual incomes and things like that, per capita income. So that we do have some real advantages over other states. The other states are they're just not going to have. And Mike.
Yeah, one other advantage that we have, I think, is that Maryland does have a very high median income. And so we have a big population of folks who are educated and able to plan well for themselves. But we, of course, want to make sure that they are doing so and they're not falling into the population that struggles with getting the care that they need, or, spending all of their resources.
Excellent point. Others? Should we pivot then to next steps? As I mentioned at the beginning, we were talking about the time frame we have. It's brief. And so we really want to condense and focus our work over the next 3 meetings. And we thought, and we don't have to do this, but we thought it may make sense to organize ourselves around the goals that we have recommended priority areas, and that we could have some subcommittees try and dig into those 4 areas. We asked folks to identify what area they would most likely want to work on. And we had, there's, 25, 30 people in this work group. We had, not everybody responded. What we found is that, let's see, of those that responded, Karen Witkowski, Robert Thurston, Scott Gottbreg, Ruth Griffin, Patricia Jacobs, Chelsea Heyman, and Allison Zabrowski said they wanted to work on affordable housing. Nobody indicated interest in affordable health care. On financial security, Mike Case indicated interest. And then on LTSS, Karen Witkowski, Letitia Rogers, and Rachel Helford. In looking at the responses from folks, Tiffany and I thought maybe people were reluctant to jump in to additional work, thinking that it was more meetings than the 4 that we committed to. But if we were to organize these work groups or these subcommittees at the meetings that we're having in the next 3 meetings, would people be more willing to participate in that? Because we want to break into these subcommittees at the next 3 meetings. Okay, Annie. Okay, Dan, we will mark you down. Can you email us back or put in the chat what subcommittee you would be willing to do? And we will record this. Thank you. Others? We want you to be involved in something during these meetings, so.
Oh, good. It looks like everybody's kind of filling up the chat with their preference, so that's really great.
Wonderful. And keep in mind, we do not have to be subject matter experts in these areas. What we're going to try and do is craft the discussion for the next several meetings, so that we have kind of a guided agenda, so that we can best use our time in developing and identifying our key recommendations. Again, what we're trying to do is come up with one, major recommendation backed by strategies that are measurable. And I'll give you that kind of framework before the next meeting. Chelsea, I say you're asking a question. Does affordable housing also include aging in place programs? Yeah. Yes. It has to.
Well, and the communities that I am in this for are people living with HIV and other chronic health conditions that create some disability, and long-term nursing homes, assisted living, um, rehabilitation centers are horrendous. And for those of us who take medications, that they don't have them there to provide for our conditions. And there is a lot of discrimination and stigma, and oh, we don't want to be around those people type things. That's what I wanted to be on here, but all of the financial security, access to long-term services and supports, all those are what are concerns of the communities that I am here representing.
What do you think you'd be best suited for, Melanie? The healthcare one? LTSS? What do you think? Given your focus.
Access to long-term services and supports.
Okay.
Because they are an F- in our communities.
I hear you.
So I guess I need to be there, but
Okay.
I could be in all of them. But
Okay.
I don't have the time.
Right.
And I think that LTSS kind of includes like where we have our priorities are sort of the priority goals. We're improving access to affordable long-term care options and addressing long-term care financing and delivery challenges. But I really think that, you know, long-term services and support are also services and support that could help people in their own homes, or, you know, so it's not just about nursing homes. So as we're talking about those I think Chelsea asked about whether the services piece is included in affordable housing. And yes, I think that's a good platform for those services and supports, but I also see, you know, the LTSS as those aging in place services and supports, if that makes sense.
Yes, it makes sense, but there are lots of people in my communities who don't have anybody to care for them, and they need to go to, even if it's short term, recovering from surgeries, hip, knee replacements, shoulder replacement. They have to go to either rehabilitation center, nursing home, or assisted care, and they are not equipped to serve us holistically.
Agreed.
Got it. I just kind of wanted everybody, like, as you're choosing your, you know, priority focus, to not think like, oh, I can only do this, because there is a lot of overlap. And, you know, like I said, the LTSS isn't just about nursing homes or assisted living. It could be that out in the community. So if that is your skill set, don't think, oh, that's just about nursing homes. It really is. It can kind of, you know, be all over the place. It really is about keeping folks in aging in place.
Correct. And that's something that I didn't understand myself until recently, that often long-term services and supports, at least as the Department of Health seems to be using it, it seems to include institutional stuff, but also home and community-based stuff too. It's all of it. Letitia, did you raise your hand?
I did, because I just wanted to comment on that. I don't know how many families that I speak to who really do not know that there is a way of connecting yourself with even long-term care insurance. And most times people are retiring without taking that option, or don't feel that they're needing it at the time. And then something dramatic happens where now I need it for an aging parent or even for myself. And then I'm stuck without that option because I didn't take it before retiring.
Yeah. Right. Right. We're talking about this literacy around planning.
It's very, very, very expensive. Long-term coverage for long-term care is very expensive if you don't get it when you're really young. And you don't, let's face it, none of us think like that. Not in our 20s or our 30s, and that's when it would have been affordable. It's very expensive. And if you have any health conditions, then it's too late. You can't even, it's just like life insurance. It just isn't affordable.
I just recently looked it up, tried to get it for my parents and to be able to get them on. My father is getting ready to turn 70. My mother is 65. And for both of them, it will be over $500 a month just to be able to cover them for long-term care insurance.
It's simply out of reach for a lot of people, for sure. Okay. Does everybody have, again, their meeting dates in your calendars? You know when they are? The next one's on the 27th. What we're going to try and do, Tiffany and I are going to put out some draft agenda, and we may have some additional people as subject matter experts to kind of enhance and strengthen discussions in the subcommittees where we need some more folks, like for instance, the one having to do with financial security and potentially affording healthcare. But we'll have that out to you all in advance of that meeting. Tiffany, do you have any closing remarks or?
No, I think you pretty much covered it. We'll, I guess, do our best to get those talking points out as soon as possible. So that way everybody has, their brain space and time to kind of think through those things. But yeah, I think that's it.
Very, very excited to be doing this with you all. And I think that we're going to create some really important action items for this initiative. So I'm looking forward to hearing what you all have to say in the next couple of meetings. Please let us know, me, Tiffany, Deira, JJ, know if there are any questions you have about the process, things that you're curious about, things you want to just let us know about. Please feel free to contact us. Okay. Are we done?
Thank you, everyone.
Thank you, guys. We'll see you.
Have a wonderful day, everyone.
All right. Thanks again.
See you next meeting.
Here.